The need to act is clear. The status quo is simply unsustainable. Healthcare costs are crushing families, businesses, and even the government. The premiums for individuals and families are rising 3 times as fast as wages. Continuing the status quo is really not an option. America can do better, and this bill proves it. The bill before us is fiscally responsible. The nonpartisan Congressional Budget Office, the official scorekeeper, relied on by both sides of the aisle, tells us that the bill reduces the deficit by $130 billion over the first 10 years. Now, those aren't my numbers. Those aren't the chairman of the Finance Committee's numbers. Those aren't the Democratic leader's numbers. Those are the numbers of the nonpartisan Congressional Budget Office. They say this bill will reduce the deficit by $130 billion over the first 10 years. The savings in the following decade are even more impressive, between $650 billion and $1.3 trillion. So shame on those who get up on the other side and say this is going to increase the deficit. We've all heard the horror stories. I've got loads of letters in my office from constituents telling me about what's happened to them, being dropped because they got sick even after paying years of premiums, being denied coverage because of pre-existing conditions, in many cases pre-existing conditions that had nothing to do with the illness for which they now need assistance, and being denied even though they've paid the premiums. Mr. President, this is serious business. This bill puts a stop to these abuses. It prohibits insurers from denying coverage for pre-existing conditions on new policies. It prohibits insurers from rescinding coverage when people become sick after they have paid premiums for years on new plans. It bans insurers from lifetime caps and annual limits on health care benefits. And it prevents insurers from charging more based on health status. It also expands choice and competition. The bill before us builds on our current market-based system and makes it better. It's not government-run health care. Instead, it embraces choice and competition. It sets up a new health exchange where consumers can shop for the best value. This legislation also expands coverage. According to the Congressional Budget Office, it covers 94% of the American people. It creates state-based exchanges for individuals and small businesses. It provides $476 billion of tax credits to help working Americans and small businesses buy coverage. There is no government takeover of health care, no rationing, no cuts to guaranteed Medicare benefits, no benefits for illegal immigrants, and the bill sets a goal of no taxpayer funding for abortion beyond the Hyde Amendment provisions in current law. In fact, this bill does much of what Republicans said they wanted in a health plan. It's fully paid for, and it reduces deficits in both the short and the long term. It expands coverage and provides assistance to help families and small businesses afford health insurance. It sets new rules to stop insurance company abuses. It reforms the delivery system to control costs and improve quality. It allows for the sale of insurance across state lines, and it supports medical malpractice reforms. Those are facts. And this legislation also helps my state. I'm proud to say it. Some have said the Medicare changes will hurt North Dakota providers. Clearly, they haven't read the bill. Right now, we get paid way below the average for Medicare reimbursement. In fact, we're the second or third lowest state in the country in Medicare reimbursement. North Dakota providers get $5,000 a year per Medicare beneficiary. In Miami, they get 3 times as much, more than $16,000 a year to take care of seniors there. This legislation includes the Frontier States provision that Senator Dorgan and I offered as an amendment. Our provision puts a floor under payments to North Dakota providers, and in other states like ours that are rural states, that have not received fair levels of reimbursement. It will mean an additional $66 million a year in Medicare payments to my state. Overall, this bill is a win for North Dakota, a win for the nation. It reduces the deficits, it controls costs, it saves Medicare, or at least extends its life for at least 9 years. It embraces choice for American consumers and competition and expands coverage. It reforms the insurance industry and it rewards quality and efficiency. This legislation is an excellent start. I urge my colleagues to allow it to continue, because we all know this isn't the last step. Next, we go to the conference committee, where we will have a chance to write the final legislation.